Hi, welcome to today's devotional podcast with Dr. Jacob Al. We took a break for some time. I was working on a project on publishing and attended a workshop for 7 days working on a book. And so I have not had a podcast for some time now. But thankfully, the book is ready. It's a 46-page book, easy to read, and very intriguing about my journey in fulfilling my American dream in this country. I think it was a project that was done within a period of time, and so they are bare minimums and not very detailed, but it's my hope and prayer that I would expand it into a more detailed book of 150 pages. But for now, it's a quick book read and it's on Amazon. You can easily get it in the Kindle and paperback form. Uh, I would leave the website link to the website of Amazon for you to be able to get that book after this podcast. But you can find the link to on my Facebook page, and you can quickly upload or order the Kindle version and read it. But it will be an interesting read, and if you happen to buy it and you read it, I'll appreciate it if you can write a review. That will sort of help in my next book publication. So we are getting back to our topic, Naked and Not Ashamed, Intimacy in Christian Marriage. We had been looking at the issue of erectile dysfunction, ED, as we know it. We had looked at what exactly it is and some of the root causes. And today we're going to continue into some of the causes. We did look at a few of the causes, but we're going to continue looking at some of the causes. So, erectile dysfunction, causes of erectile dysfunction, part 2, and this is episode 63. As usual, our text is taken from 1 Corinthians 7:3, which is reading from the NLT, which says, the husband should fulfill his wife's sexual needs, and the wife should meet her husband's needs. 1 Corinthians 7:3. So the problem of erectile dysfunction may have a rapid onset due to psychological causes such as a feeling of inadequacy or insecurity. So when the man or the husband is faced with a sense of inadequacy or insecurity, then it could work its way to an anxious husband filled with anxiety, which could trigger this erectile dysfunction. So it is important that men learn to relax and not be jacked up, whatever the source of the anxiety is, especially when it comes to love making. There is the need for men to relax and understand that there's nothing to panic about this. And obviously, when there is a good communication between the husband and the wife, and and the relationship is good, there will be no need for any tension and anxiety. In the sense that if even the man fails to get an erection, if he has learned to still be able to bring the wife to orgasm, then there will be no need for any tension and anxiety. The tension and the anxiety will come in the area of sexual intercourse when the husband thinks that the only way he can bring the wife to orgasm is through the insertion of the penis into the wife's vagina. And so when you don't get the right erection to be able to do that, then most husbands think that they have failed. And so any future attempts at sexual intercourse is full of anxiety. They are not sure whether the erection will come or it will die halfway through the process. So they are filled with anxiety, and that could even be the very thing that will cause them to experience that. So there are often psychological aspects to this condition, as well as organic factors that may contribute to it, including hormonal imbalances, neurological disorders, cardiovascular issues caused by diabetes or tobacco use, and various medications. So, as should physicians conduct careful history and physical examinations and other appropriate laboratory tests, such as the testosterone and thyroid levels, among others. So, some of these conditions are quite psychological, but some of them could be organic that needs further investigations, and therefore there's the need to talk to a doctor about this. Now, especially if you are a diabetic patient, you should understand that there is the probability that somewhere sometime during your life you will begin to experience some form of erectile dysfunction as a result of the diabetes. So men with diabetes are prime candidates for erectile dysfunction. And also, if you are a tobacco user, if you are a smoker, it is possible that, and as we learned last week, heavy drinkers, drink people who drink heavily, or drunkards, are also likely to experience some form of erectile dysfunction. So, if this happens, your doctor will be able to conduct certain tests. If you take care of the psychological effects of it and still there's no remedy, it is important to talk to your doctor to look at the biological or the organic issues that may be involved here. And most doctors in this area will order certain laboratory tests, such as the testosterone and thyroid levels tests. Just these are two type of tests that the doctor can perform on you to identify where the root causes of this problem is coming from. So, in some cases, determining the organic cause can be crucial for diagnosing a medical condition, since it may be the first indicator of a problem that needs to be addressed. So, one of the most common examples is diabetes. People with diabetes who cannot control their diabetes eventually succumb to erectile dysfunction at about 40 to 60%. So, despite their inability to have an erection, these men can almost always ejaculate normally, which allows them to enjoy sexual relations, so that each can learn how to provide the best manual stimulation to the other. This requires both husband and wife to develop more enjoyable physical closeness and open communication. According to researchers, there is no difference in vaginal lubrication and desire in female with diabetes when they are sexually active. So this is the thing. I mean, this is a very, very crucial and important information for diabetic husbands. Because of your diabetes, it's most likely that you run into some problems of erectile issues. Now, it is said that 40 to 60% of men with diabetes will invariably have problems of erectile dysfunction. Now, in saying this, however, when, as I mentioned earlier, when there's open communication between the husband and the wife, even men with diabetes uh, who may not be able to have very strong erections can still have ejaculations. One may ask, how can that be possible? I thought you need to have an erect penis to be able to ejaculate. That's not necessarily true. um, Men can, studies have shown that men can ejaculate even when they don't have very strong, powerful erections. And so once a man is armed with this knowledge, when he's going through the act of sexual intercourse, and for some reason or another, the penis begins to dwindle or cool down and the erection vanishes, there is no need for the man to panic, because very often what happens to men is they just in exasperation give up and they leave. They just throw away every caution, and just stop the whole act, and so the woman is left lying down not knowing what to do. But it is important, as I keep saying, when there is open communication between the wife and the husband, even in this situation, when the man realizes that he's beginning to lose his erection, he does not need to stop the act of sexual intercourse. He can continue. There are several ways that he can continue to be able to ejaculate himself and even to bring the wife to orgasm. And that is why it is important as husband and wife, you don't restrict your love making to only penile erection and insertion and vaginal uh, 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 orgasm. Now, if you limit yourself to these, then when there is a problem of erectile dysfunction, then the man is bound to stop and cut short everything, and everything ends there, and then the frustration and the anxiety begins. But a man who has learned that he can still ejaculate even when the penis is not fully erect, then he will be able to continue even when he experiences some form of erectile loss during the course of foreplay, or even uh, 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 intercourse. Now, you ask, how can that be possible? Okay, I am in the act, and all of a sudden, I'm about to penetrate, and I realize that uh, my penis is not hard enough to even penetrate into the woman's vagina. What do I do? Now, you don't panic, you don't get out. You need to understand that, as we said, you have several things that you can continue doing to your wife, and she may not even experience that you have gone through an erectile problem. How can this happen? What you do is, as we learned in previous episodes, you have your fingers and your tongue to be able to induce your wife to continue the act and the passion. And if you have learned the techniques of uh, 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 premature ejaculation, if you have learned that technique, then your wife would have been used to the fact that even during intercourse, you will have occasions where you will pull out of the vaginal insertion to allow you to cool down. And obviously, if you're going to employ the technique of the squeeze and release method, then you obviously would have trained your wife to a point that she's aware that you are not the type who just penetrates and keep banging and banging and banging till you ejaculate. Because why? Even in such situations, you have learned that you will probably ejaculate without bringing your wife to the level that she can gain orgasm. So what happens? You learn the technique of pulling out to cool yourself down, and while you pull out, you're still playing with your wife's clitoris or even her breasts. And so she is also being aroused even after you have pulled out. And you can continue if for some reason you realize that you are unable to gain powerful enough erection to penetrate, you can then allow yourself to use your fingers and your lips and your tongue to massage your wife's clitoris to a point that you can bring her to orgasm. And in that act, even you will realize that when you are arousing her and she's coming up, for one reason or the other, it is very mutual. The act is very mutual. As you continue to give her pleasure and you did not stop, you continue giving her pleasure, and you begin to see her receiving that pleasure and her extent of excitement increases. It 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 it, it reflects on you as well. You will notice that for some reason, because it's a mutual understanding between the two of you, you will begin to notice that the erection that was lost will begin to come up, and it would be strong enough even at the point where she's so excited and she's about to come. You can insert her, because at this point she would have been well lubricated enough for even for a not so strong, powerful erection can still penetrate her, and you could together, you could ejaculate and she could come to orgasm, even though somehow, some way, you lost erection at a point. Some men think that the only way they can get their wives to orgasm is a hard, full banging in the wife's vagina. That would be the only way they can bring her. And most often, women, a lot of women hardly come to orgasm with such thrusting, vigorous thrusting up and down. Because previous episodes, we have learned that there are two levels of excitement when it comes to the woman's vagina: the clitoral excitement and the deeper penetration of the PC contraction excitement that comes. And so it is important for men to understand that even during this time of erectile dysfunction, they can do a lot by not ceasing the act, but continuing to pleasurize their women to bring them to a point that their penis would be strong enough to penetrate very easily. Because once you continue with the foreplay and bring her to a level that she's all wet and soaked, a very loose and less fully erected penis will be able to penetrate, and you will be able to ejaculate even at a half level of erection without your wife even noticing that you had any loss in erection, because at that point she is already at the peak. And so anything that touches the clitoral area, no matter how weak or even how weak the penetration is, it still gives her excitement, because at that point her contracting her PC muscles has already brought her to that level. So she doesn't need your banging to get to the extreme or to get to a point where she can orgasm. You need to understand this as a man. And men who understand this will never be disappointed. They have no reason to be anxious and to be afraid that they will not be able to bring their woman to orgasm. Okay, so your doctor must consider these things. Again, as we said, several factors when determining the causes of erectile dysfunction. There are a few examples here. Number one, alcohol. Indeed, alcohol sometimes triggers a feeling of sexual desire, but it also estimates the ability to perform or enjoy sexual unions. It also eliminates the ability to be able to enjoy. So some men think that they are incapable of ejaculating or enjoying sex unless they take some alcohol, and it's a myth, because the very thing that will cause you to be excited could be the very thing that will knock you off, and you will not be able in the end to perform and enjoy this union. So in a way, uh, alcohol inhibits the coordination or the coordination or speech of a person. Alcohol also acts as a depressant on the nervous system. So, in most cases, alcoholics lack the average sexual ability due to their inability to control their drinking. Okay, so practiced alcoholics are 50% more likely to suffer from erectile dysfunction. Men who are alcoholics retain a normal sexual desire, but are likely to complain bitterly about the loss of their sexual ability. As a result, he often turns to alcohol for even more escape. So that is the thing. If you are somebody who is alcoholic, you are bound to have problems with erectile dysfunction. And sometimes you think that um, you the only way you can solve this problem is to go in for more alcohol, but you just will be making the case worse. You'll be making the case worse because the thing that alcohol will do will drive you to want to have intercourse. But then, as you try to, the depressing state of alcohol will then affect your nervous system and weaken the nerves that sense the hormones that will cause your libido to be high enough to enjoy sex. So when you become disappointed, then you think that the best way out to escape from the situation is to go in for more alcohol. And then you just repeat this vicious cycle of, anxiety, failure, frustration, and depression. And so you need to get out of that. You need to get out of that. Another thing that could cause uh, uh, this type of erectile dysfunction is fatigue. Men with regular sex drives are most likely to experience decreased sex drives due to simple exhaustion. The condition of erectile dysfunction may be triggered by episodes of fatigue, resulting in an inability to achieve an erection. Many men came from home, come home from work with such a depleted level of both emotional and physical energy that they are simply unable to have a satisfying sexual relationship. It is easier to avoid many of these difficulties when one waits until one is rested and accepts the sexual energy decreases and one rests okay, when one is rested and accepts that sexual energy decreases with age. Now, initiating early bedtimes and discouraging activities that keep her husband awake can help a wife to help her husband sleep better. So this is the thing. I mean, most men come from work. You have a long day at work, and you have a long commute back home. And so by the time you get home, you are emotionally and physically drained. Now, your wife has been home watching all these movies, and she, especially if she's not somebody, if she takes care, if she's a home uh, a homemaker and does not work and just takes time to take care of the kids, she's emotionally aroused and waiting for you, and then you come home and you slump straight into bed and you just are incapable of doing anything. And women would understand this. The fact is this: if you are a wife whose man is so busy at work and he comes home exhausted and emotionally drained, when he comes home and he eats and goes to bed and you start jumping on him, it's most likely that you will not have uh, an adequate sexual experience with him because he has been emotionally drained and he's physically tired. So in such situations, the best time is when he's well rested early in the morning before he gets up to bath and go to work. Those will be the best times you will enjoy sex together because he would have been well rested at that point, and you can have your sexual encounter, then he can bath and go to work. So if you are a wife and you understand that your husband comes home exhausted, then you don't disturb him. Allow him rest when he has eaten and taken his bath. That is not the time you should be all over him demanding sex. He's so tired. He's emotionally drained, physically drained. It will be impossible for him to fulfill your desire. So the best thing is to get him to rest adequately, and then early in the morning, before he gets up to bath, you can initiate that. If you know exactly how much good time he has to be able to wake up and then have the encounter with him, then he can bath and then get to work. And in fact, he'll be well awakened at this point to be able to go in to work and put in the best time that he can at work. Because why? You have put some excitement in his life, and all the romantic aromas will be all over him, even as he baths and goes to work. Okay, so if a woman is not aware of this, you will be disappointed, and you will think that your wife doesn't love you, or your husband doesn't love you, or that he probably has a mistress and he goes there after work and he comes to home very tired and he's not able to satisfy you. But it's just understanding that the timing is wrong. And that is why open communication is always very important. Another thing that could be a trigger of erectile dysfunction is obesity. The testosterone level in an obese man weighing an average of 250 pounds and above rose significantly after 8 weeks of eating a strict weight reduction diet in almost every case reaching normal levels. In addition, these men's level of female hormones were twice as high before they lost weight, and those of normal weight men. Uh, Excess estrogen is created when a substance within the fat cells undergo a chemical change. A male's sexual function is believed to be impaired by this estrogen, which inhibits the release of testosterone from his testicles. Weight gain may also contribute to hormonal imbalance, physical problems, and diseased self esteem and self confidence, in addition to hormonal issues. So, in every way, obesity is a huge, 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 huge uh, factor in men's erectile dysfunction, as we have seen. Um, this study that put some men who weighed over 250 pounds on some special diet within 8 weeks, uh, their weight loss uh, was responsible for these men's level of hormones uh, increasing, in a sense that they could then twice pre the period of time that they were not overweight, they could enjoy sex twice as much as when they were not obese. So, in other words, simply what this study is saying is that, hey, if you are if you are a man and you weigh over 250 pounds, uh, it is important you understand that it could be a factor that could inhibit your sexual desire and performance. Some form of diet and exercising in reducing your obesity uh, could help tremendously because you are able to overcome the various problems that comes even with obesity. Not it's not only the fact that you will have what is a decrease in your self-esteem and self-confidence. So in addition to the hormonal issues that you'll be going through, so a weekly uh, 2 times, 3 times sort of exercise, simple exercise could be very helpful for men who are struggling with obesity. Another cause of erectile dysfunction will be smoking and tobacco products. So, a recent study compared the testosterone levels in the blood of a smoker with non smokers and found that after 7 days of abstinence, the testosterone levels return to almost normal levels. Men with otherwise healthy testosterone levels reduce testosterone levels when they smoke heavy cigarettes. So, a doctor in Tulane University School of Medicine, Alton Osner, stated that based on my extensive clinical experience, I'm convinced that smoking is a primary cause of erectile dysfunction in today's society, particularly among young adults. Okay, so as well as lung cancer and heart disease, smoking is also associated with stroke and poor circulation, which decreases vigor and blood flow in the penile area. So, I mean, these are things that, I mean, they are scientifically proven. So, if you are a man that has all this going on in your life, then you want to do the things that will help you to be able to enjoy your marriage and intimacy with your wife. You have to choose to become a non-smoker, so that you will be able to develop the necessary testosterone levels to be able to stay erect and satisfy your wife in the act of sexual intercourse. So, apart from the fact that honestly you'll be saving your life, because smoking obviously affects your lungs, and a lot of lung cancer and the rest. So if you didn't know, and those who thought that, hey, maybe smoking helps, they are in trouble. They are in big trouble because when it comes to erectile dysfunction, smoking and alcohol are very huge causes of the problem. So, an erection may be difficult if blood vessels have become damaged enough by smoking. So, obviously, we know that erection basically is the flow of blood into the penile area. So, if due to smoking, these vessels, blood vessels around there, are damaged, then you are as good as dead because the very vessels that the blood will gush in when there's an arousal is dead, and so it becomes difficult for anything to happen. So it is important that this is taken care of. Okay, so again, another form of erectile dysfunction is drugs, certain over-the-counter drugs. The opioid pandemic that is happening in this country today is a heavy source of erectile dysfunction. Uh, this over the counter medication may cause erectile dysfunction, such as blood pressure pills and certain other medicines. Here is a partial list of what your doctor can identify for you: tobacco, alcohol, recreational drugs, SSRIs. For examples, those are Prozac or Pexel, uh, clonidine, and diuretics, thiazides, and spironolactone. Now, tricycline, antidepressants, anti antihistamines, and beta blockers. These are all uh, signs and things uh, that could that are identified to be issues, to bring issues when it comes to erection. And uh, you will be well advised by your doctor as to what to do to be able to correct these issues. And remember, as we have discussed, there's nothing that is impossible for God to do. And so, if you are a Christian couple and this is a serious problem, it can be solved if you take the necessary advice from your doctor and do the things, avoid the things that will cause this to happen uh, and prevent you from enjoying each other fully. So, thank you for taking time to listen to today's devotional podcast. We will continue with the list. There's many more we can talk of and open our minds to this very issue. So stay tuned as we look still into this. Remember, we haven't come to. We are still identifying the causes. We will come to a point where we will begin to address some of these causes and what a man can do to overcome this problem of erectile dysfunction. So thank you so much for taking time to listen. Just be stay tuned for more of these episodes as we address all the causes. Then we will begin to address the resolution to these problems, or the remedy, or the things that can be done to remedy the situation. Pray with me. My Lord and Savior Jesus, we thank you for the knowledge gained in this area of sexual erectile dysfunction. Thank you for the knowledge, for your word says, for lack of knowledge, my people perish. Thank you for the knowledge that you are giving your people, that they will become equipped enough to be able to do things that will correct the situation that they are in with regards to intimacy in you and obviously in their marriage. I pray that you will bring healing to areas that are organic and biological that needs healing in the organs of these couple in any form or in any way, because with you there is nothing that is impossible. So thank you, and thank you for coming into these marriages and healing these situations that will bring back life and rejuvenate their marriages. In your precious name I pray. Amen. So, beloved, once again, thank you for tuning in and downloading this video to listen to. Send your comments and your questions. You can send me Facebook inbox messages. It'll come directly to me. And you can also go to WhatsApp and look for Jacob, Dr. Jacob Al Hassan, and send me your questions through WhatsApp. And you can also leave your comments on the YouTube channel. So thank you for taking time to listen to today's devotional podcast. And again, remember, you can put my name in Amazon, Jacob, Dr. Jacob Al. It'll pull up my books there. And you can get the book, the e-version of it, for $2.99 and the paperback for $12.99. They are both life. That is the simple guide to fulfilling your American dream, a success story of a Ghanaian immigrant. There you can read more about my story. In fact, an introduction to my story, where a deeper version of it will come in the future in a 150-page book. Thank you for taking time to listen to today's devotional podcast. God bless. Thank you.